Okay, so as we said, we need to face the second part of the morning talking about health, healthcare, artificial intelligence, and we mention it very much, but artificial intelligence is revolutionizing healthcare. But the real question is, what's actually making an impact today? With deep experience in hospital and healthcare innovation and health tech investment, our next speaker is going to offer us a rare, a real dual perspective, because he's basically the innovation director at Hospital Clínic Barcelona and venture partner at Nina Capital, and he's helping shape how AI is transforming medicine from inside out. I would like you to give a big applause to Jorge Juan Fernández from Hospital Clínic.
Hello, everybody. Good morning. Thank you, Tech Barcelona, for the invitation 1 year again, and to Miquel Martí, the CEO. It's a great pleasure to be here today, and I'll be talking about AI in healthcare. Healthcare, alongside with finance, is one of the two verticals in AI with, it is expected, great impact and successful applications, right? I have structured the presentation into 4 blocks, but I've used this slide the year before, which is a disclaimer, and I think I'll be using it more often down the round, because there is a mismatch between what you hear in conferences and what you read on LinkedIn, and what is really happening in healthcare settings, such as hospitals and other places, okay? And I'll be talking about the second part, okay? So let's kick off the presentation. I have prepared 4 blocks, and the first one, it's a little bit about outside of healthcare, but it's very important to understand what's happening in healthcare, okay? I want to introduce you this 4-layer framework from my good friend Nicolas Colin, okay? Basically, this framework talks about that a lot of the people, when we talk about AI, we talk about these AI models, the green layer, okay? That's where all the publications, all the models, all the discussions are happening. The flashy movements are happening here, right? But in order to be successful, let's say the AI performance and economics are inseparable from the physical computational power behind, right? And that's why there is this energy grid, these data centers, AI models, and this integration and adoption. And I'll be talking about a little bit about all of them, okay? Let's start with the first one from the bottom to the top, energy grid, okay? This is Eric Schmidt, former CEO of Google. You know, he told the US Congress that AI already consuming 3% of global electricity, 3%. And that's where it gets interesting, for the things that AI wants to do and is already doing, we will need 99% of all electricity, okay? Again, 99%. So basically all electricity should be devoted to AI, basically no electricity for heating, lighting, or anything, right? That's why the discussion around electricity and different types of energy, renewable, non-renewable, are already on top of the table for governments and companies alike, okay? Same approach from Microsoft CTO. It's been almost impossible to build capacity fast enough since ChatGPT launched, okay? Very important, if I ask you, how many people use AI daily here? Raise your hands. Okay, everybody, good, okay? How many people here pay for the tools that are there? You know, less than half of it, okay? And my point is, when you use these tools, and here you might not understand the metrics here, but you can see, you know, ChatGPT 3, 4, and 5, the electricity per query and the water usage per query increases, okay, as it goes through, right? Let me translate that for you. Each ChatGPT 5 prompt consumes 10 to 15 times the energy consumed by a standard Google search, so 10 to 15 times. And in terms of water usage, around 2 to 5 liters of water due to the cooling requirements to operate the service processing these queries, okay? So 10 to 15 times, 2 to 5 liters, okay? So if you're concerned with the environment, when you make a decision whether to search on Google or to search on ChatGPT or Perplexity, think carefully, okay? So that's the second piece, right? How are we solving this? The discussion, as I said, around nuclear energy are back on the table, and new discussions are already coming back, which is this thing called extraterrestrial data centers. So basically creating data centers that are, let's say, orbiting on the space. Why is that? Because on the space it's cold enough, you know that, but also you're able to capture the solar energy, right? So this is something, you know, coming up. It's not a dream. You have people, I'll show you a couple of things now. What is the numbers in terms of energy grid, in terms of nuclear, right? These are the key players. The US is a big player here. It has more nuclear energy than China. Number 4, which I think is 5 is Korea, and the 4th I don't know which is. And then as you can see, France is also a big player there, okay? Very important, the winners of this AI race will be the regions that solve the energy equation first. Why? Because it's high energy consumption behind the AI, okay? Let me talk about data centers, the block number 2. This is a key infrastructure, okay? As you can see, the US has more data centers than all the other major countries combined, okay? If you take a look at, every place, every region in the US, they're building data centers. It's part of their economic growth development, okay? Virginia is the Silicon Valley of data centers, in case you didn't know, okay? All companies, governments are building on that, okay? It's a real infrastructure, and basically also government is involved in that. This is the first, what I call the first big US project. It's called Startgate. I would like to recommend this short video from Emily Chan from Bloomberg. It's called The Circuit. She tours around this mega factory called Stargate. Okay, very interesting. It's a bit old, but you'll see how big it is, what's the key messages behind, okay? It's not a single building, this is Stargate. It is a network of giant supercomputers being built across the US, okay? The first one is being built in Abilene, Texas, okay? And it's as huge as 900 acres of land, which translated is 700 football fields, okay? 700 football fields altogether, pretty big, okay? The construction of data centers is really, really going up. If you compare this to offices, retail, warehouses, and data centers, you see the data centers is the lower line, started in January 2015, and is increasing recently. If we take a deep dive and look into only the office versus the data center construction, you can see that since ChatGPT launched, the numbers is increasing, and data center construction will overtake probably office construction very, very soon, okay? So people are investing here, making big monies going to here, right? If you take a look at all the research, market research companies, all the consulting companies, they all have data coming out. If you can say, it doesn't matter the company or the bank, but basically what you can see is that in terms of usage of this capacity, we're talking about doubling or tripling, okay? Really, this is what is behind that, okay? So as I said, if I go to these data centers in orbit, I said before, it is not something, it's not a dream. You have here Elon Musk, who is testing space-based data centers in 2026 with a performance of 10x the capacity that they have today. That's the first thing. Sundar Pichai from Google, he says something different. He says, in 10 years, data centers will be orbiting Earth. They will not be on Earth grounds. So very, very interesting, this new approach behind that. So when the grid is short, we're running out of it. Basically, we just look for new sources of this, right? Let me move to the third pillar. This is where the third layer. This is where everybody looks at it. All the flashy eyes. Every company, my model is better than the other. My new model is better than my old model and my competitors, etc. I've just put something like this here. I don't even read this article. Okay, it's just the medical literature is full of these articles comparing different models, and when applied to different companies, with different fields of knowledge, it can be radiology, pathology, cardiology, neurology, doesn't matter. Okay, that's the important thing, but it's a comparator. There is basically leaderboards out there, it's like classification, like rankings, which model is best, okay? There's a huge amount of models being developed there. The red lines are the ones by OpenAI. You can see many, many of them. Most of them are tested, in healthcare. Healthcare is, as I said, a very important one. Some of them are working, but basically the idea is that still we don't have, or at least in healthcare, we have many ways to measure performance, right? So performance is not about speed and cost. It's about, in our case, for example, false positives and other type of problems, okay? Now, what is the challenge? The challenge in healthcare, and that's what I'm getting a little bit into my field, is that things are a little bit different. This paradox is emerging in healthcare. What does it mean? Basically, clinical LLMs, so LLMs apply to clinical tasks or healthcare tasks, outperform clinicians in studies. So in studies, everything works, right? But when we put it into real hospitals, in real settings, they underperform reality. Why is that? Well, basically because in trials, everything works, everything is very structured, everything, is, the next step is very explicit, okay? At the bedside, when the patient and the doctor, or the nurse and the patient interact, things are not as steady. It's really, really messy, right? So the models are capable, but the integration of the healthcare professional and the machine doesn't work as well. Okay, so that's an important one when we talk about models. Yes, they work very well in clinical trials, in studies, but when we put them in real hospitals, in real settings, they don't work as well. Okay. That brings me, as a segue, to the last layer, which is integration and adoption. That's a very important thing. This is the Mayo Clinic. The Mayo Clinic is the, is the leading healthcare institution, I would say, in the world. It's in the US. And basically, this is the CEO of the Mayo Clinic announcing a new person that is incorporated into the company. The person is a Chief Artificial Intelligence Implementation Officer, okay? So they already have a Chief AI Officer, but they have recruited a Chief AI Implementation Officer. Why is that? Because they've realized that models by themselves, they might work, but it is implementation where it gets tricky and difficult, okay? This guy, Mickey Tripathi, okay, he's not a technologist, or he's not a business person. He used to work for the Biden administration. His major is in political science, no problem. But what I'm talking here is you need a management expertise to convince people this is not about technology, this is about process management and change management, okay? Very important when we talk about healthcare in hospitals to think through what I call these 4 possible quadrants of AI applications. Okay, you see in vertical, in vertical you say clinical and non-clinical, and in the horizontal you have professionals on one side and patients and consumers on the other, right? A lot of the things happening in healthcare are happening in the number 2. So basically things that are clinical. For healthcare professionals, okay? All the European Union grants, all the national grants, all the regional grants, most of them, 99.9, they're targeted to this, okay? My point of view is that if we want to make sure that this, scales and create the real impact, it is number 3 that will work very carefully, right? This is for non-clinical uses, for example, how can we make the operating room more efficient? How we can make the consultation rooms more efficient? This type of thing is something that can be spread across the whole institutions, right? And rather just for one single thing, okay? Very important deciding where you will put the focus when you are trying to adapt, because you cannot integrate all the algorithms that are out there, right? So you need to choose, and my suggestion is pick and choose, starting for things that are at number 3 here, okay? And now if I take a look under the hood, this is very important. I want to talk a little bit about Europe and our digital sovereignty, right? If we take a look about, debajo del capot, no? Then we can see that the data storage, usually we have Amazon Web Services or Microsoft or Google, right? In computer, we got NVIDIA, in the LLM layer, we have OpenAI. Mostly, you have other opportunities now, right? But it is only on the application layer that we see European companies, right? But below, there is nothing. So this raises an important question. I'm super happy to talk about that with Pep Martorell later down the line, right? We need to be doing work here if there is a real possibility for EU digital sovereignty in a critical infrastructure down the line, okay? So insight number 1 to close this first block, it is about, hey, we face existential challenges, not only on the market side, but also on the democracy side. And I suggest that we take a look, that you read this Authoritarian Stack by Francesca Bria, who talks a little bit about these things in depth, okay? So let me move to the second one. How will humans and machines work together? We need to rethink, this partnership, okay? In 2019, when I was at TAT Health, I was very interested not in the technology, but in the impact of the technology in the workforce and in organizations. So I commissioned this work with McKinsey Company. We did a thorough work with McKinsey and with the McKinsey Global Institute to try to answer, okay, whatever the technology is, what will be the impact of this technology in the workforce, and what will be the impact on the organizations, right? Because people were worried about, things that you've heard many times, they will steal my jobs, etc., okay? So 3 key messages. Number 1, medical jobs will not disappear, okay? So relax, okay? Second message is, yes, of course, some tasks and activities that medical professionals do will disappear because they'll be automated or even restructured, whatever, right? But some will disappear. And then the impact will not be uniform across all the specialties. So radiologists and pathologists will be more impacted than, for example, dermatologists and less than cardiologists, let's say. Okay? So what is critical is to think of these workflows, these clinical workflows, to try to understand what can be done. And that's what the story started, right? So the story started with this thing, basically, hey, AI will substitute doctors, okay? That was the first unique selling proposition. You'll get things like, this guy, you know him, he said, self-driving cars in 2 years, that was 2015. Jeffrey Hinton, Nobel Prize, radiologists will be obsolete in 5 years. Hey, here there are radiologists in regular cars driving to work, okay? Very funny, but this is the reality. We haven't stopped at Hospital Clínic recruiting radiologists, just to be clear, and elsewhere around the world, okay? So AI will substitute doctors? Not really, okay? So then the next stage was, no, it's not like that, AI won't replace clinicians, it will augment them, okay? It will be a tool for amplification. Okay, just to be clear, okay? It will not replace medical professionals. It will only, of course, replace those that don't use it, okay? But basically, the machine, and the humans will work together always, of course, right? Then we get these studies more and more, and what we're seeing, this is a study from Eric Topol, basically, these numbers showing that AI alone outperformed physicians using AI, right? In the previous thing, basically all the studies were proving that AI together were better than doctors alone or AI alone, right? More and more studies are showing that AI, in some cases, outperformed physicians using AI. Why? Because of the implementation issues, the messy realities of the clinical world, right? So we need to make sure what is going on there, right? Very interesting. And then what has happened, if this is true, if AI alone can do certain things and we don't need to have a physician by its side, not all the time, is that it opens the door for what we call division of labor, right? This was very famous, Adam Smith, 1776. But there are three operating possibilities here. Is divide the work by the process. Maybe you can have the AI at the end or the AI at the beginning, and then you have the physicians, complementing that. You can do it by complexity. You can ask the AI to do the routine, simple cases, and the physician handling the complex, more risky cases, okay? Or you can do that by eliminating redundancies, for example. In healthcare, sometimes we have certain protocols and guidelines where we have two physicians doing exactly the same process. The second one basically is making sure that the first one did the right thing, okay? For example, we have this example from Capio in the Nordics, Sweden, since June 2023. They have replaced one radiologist, the second radiologist for an AI machine in the mammography screening process. So basically, you get rid of a second, right? But you still have one physician doing that, okay? So division of labor is very important, right? So we still lack definite proof. That's my main message for this. First, it was the doctor alone. Then we moved on for the AI alone. Basically, AI will replace doctors because, that was the message, AI is better, faster, and cheaper than doctors, right? You've heard that before. Then we're talking about AI plus the doctor. AI will augment the doctors, right? So only those who don't use AI will not be augmented, right? And now we're at a point where we say, hey, AI alone outperform physicians using AI. And then the point here is, okay, how can we orchestrate, these workflows, right? The message here is very clear. The workforce of the future will be a partnership of people, agents, and robots, right? And that's not that far away. It's not 10 years down the line. It's coming up in the next years for sure. People and agents, very clear, right? Very important. This is not only about these three groups, but also leadership is crucial. Why is that? Because they need to be leading how this transformation is happening. Okay. Capital investment. Where is money going? People are worried about us. This is Sam Altman, very worried. He should be very worried. It says people will overinvest and lose money, and underinvest and lose a lot of revenue. Of course, not clear, right? So there's some thinking to be done here, right? Sundar Pichai is more clear. So there is a risk of underinvesting. I'm clear, but the risk is higher than overinvesting. So we should overinvest. Okay, so if we underinvest, the risk is higher for companies like us. Certainly for Google and for OpenAI, this is clear, right? For the business altogether, for society, we'll see, okay? Healthcare, heavily invested in AI, number 3 in terms of investments, 11 billion in 2024. Numbers for 2025 are higher than that. That's number 3, but if you can see that number 1 and 2 basically is infrastructure, the 2 layers that I presented below, the energy and the data infrastructure, okay? So very important, it's the number 1 area where investment is going there, right? If we take a look just in Q1 2025, 6 of the 11 new AI unicorns globally were healthcare focused. Names like Abridge, Neko, Hippocratic AI, in silico medicine, open evidence, Truveta. Really, really, very, very important what we're discussing here. Companies, the new AI companies, the new AI unicorns, most of them are healthcare companies, right? And then this is a novelty as well, what we call mega rounds. What is a mega round? Basically, startups raise funds, let's say every 2 to 3 years, to continue their process, right? We have here companies like Hippocratic AI, which basically they raised, every year since 2023, and not small amounts, so this is not a bridge investment, right? You get open evidence, which has raised 3 times in 2025, not small amounts either, right? For a $6 billion valuation. And a bridge, same thing, 2 times in 2025. So basically, there's a lot of money being invested and at the same year. So really the moment is now. Of course, the question is whether there is a bubble or not, and then I'll discuss this with paper later on. When we talk about OpenAI and the unit economics, this is a study that has been done by HSBC, the bank. Basically, what they say is, well, they're nowhere close to closing the gap between the contracts for computing power that they have committed to versus the amount of hands that has raised the hands that they pay for these things, right? Most of the people are still using it for free, right? So this gap, see what happens out there in the next years, right? So as I said, that's what is happening, the bubble. Some of us have lived through other bubbles. My first bubble I was working in London with the internet bubble, very interesting, and I think we need to be looking at that again, what happened and what we can do. But basically, a bubble is a point where the asset is overpriced and doesn't reflect the real value of it, right? So the question is, are we in a bubble or not? Economic newspapers are plenty of those articles every day, whether there is or there is not, okay? So the insight number 3, and that I can attest for sure, if you study history, history teaches us that whenever unit economics don't work, bad things happen, some restructuring, some changes are ahead, okay, because we cannot pay for things. I really thank Leonardo for this great picture. I think it's really marvelous, the movie and the picture itself, okay, really shows that. Very, very important. If unit economics don't work, changes are coming, okay? And now for the last block, where is AI now? What can happen in the next months, now, days, weeks? It's really challenging when we do these type of presentations to foresee the future, okay? Here I'd like to talk about the 3-speed AI adoption between 3 players, basically the patients, the companies, and the hospital, right? That's really our business when we do that. There is really a bottleneck because they are running at different speeds, okay? Let me start with patients, right? So patients, they are using AI tools, much faster and before than hospitals are able to to orchestrate them and let's say to put them into practice. This is an article at the New York Times in November. Basically, frustrated by the medical system, patients turn to AI. Some quotes from the article, very interesting. ChatGPT has all day for me. It never rushes me out of the chat. That's a patient, right? Second one, I can get more information from ChatGPT than I can from you. That's a patient to a doctor, okay? If the system worked, the need for these tools would be far less, but in many cases, the alternative is either bad or nothing, right? So the healthcare system is really complex. What we're getting out of the labs and the medical records is really complex, and this tool allows patients to do that, right? So patients are using AI with or without the doctor, okay? Second, there is a movement. There's a hashtag called Patients Use AI Movement. They share ideas, they share connections, they share a lot of things, very much in the same idea of the social media times where people started to share, what is happening there. Okay, so that's the hashtag Patients Use AI. And they are also requesting access to tools that only belong or are only used these days for clinicians. The most common one is Open Evidence. Open Evidence is the second tool that almost every physician has open in the US, let's say, right? They have all the EHR, the other things, and then they have open evidence or doximity on the side, okay? Basically, it's just a place to look for information of the science and other things and not for the patient, right? Patients are asking for that. Hey, why cannot I use this, okay? If it allows me to, to dig through research papers and to look into news and to understand this, why cannot I have access to this? So there is a debate in the US these days. We want as patients to have the same access as physicians have to these tools. Okay. In terms of companies, big tech, the tech titans are fueling AI initiatives. All of them are putting money into AI, of course, but into AI in healthcare. Google just last week launched something called Impulse Healthcare, just for the European Union, right? Where basically they're doing these things, right? So they're really putting a lot of money into this, big tech, right? If we move to big pharma is putting money in two places. One is drug discovery and drug development. They're using AI to accelerate that. Everybody's doing something, they don't share it. Okay, I'm not sure why, if this is because it's not working or because it's working so good that they want to say it so the prices don't go down. I don't know, but that's one thing. Where they tell really clearly that they're using it is for, I'm going to call it for gaining operating efficiencies, right? This is the case of Novo Nordisk, clearly stated that they're using AI to submit all this paperwork that they need to do for the regulatory agencies, for the different medicines when they approve them, right? And really there are major efficiency gains out there, right? Time reduction from 15 weeks to 10 minutes per report. Again, from 15 weeks to 10 minutes per report, okay? That's really, really a gain, right? Team reduction from 50 plus people to 3 humans. Cost savings, the annual cost of AI is less than 1 human medical writer, right? So really, really, it means that, hey, there is money to be saved here also for private companies, right? So very, very important. Again, the message is, hey, we're not doing this to get rid of people. We're doing this to, be more efficient, right? The government is also being involved here. Very important. This is a Genesis mission just recently. This is what I call the second big US project. Basically, the idea is that this guy, the president of the US, launched a strong initiative to just collide or converge or get together their national labs, all the data sets that they've been curating and paying for over these years. A lot of data is sitting on their grounds, and America's largest supercomputers, okay? And basically to transform this into an AI discovery platform. Of course, this is not for healthcare alone, but healthcare is probably first or second top user of these, right? So very, very interesting, this idea of turning existing R&D into faster targeted breakthroughs, right? I think that before he leaves office, if they do good stuff, we'll see interesting things coming out of this because really this is transformative approach from the policy perspective, right? And then hospitals, and what happens in hospital is that the front door is moving. Very, very important when we do these things, right? What does it mean? In the 90s, we had the in-person visits. Basically, almost everything was happening when the doctor and the patient was meeting. The doctor enjoyed asymmetry of information. They knew everything, and the doctors knew very little. Then we get the early 2000s, the arrival of the internet, the famous Dr. Google. Patients started using Google or other search engines in the internet to look for information or even to self-diagnose themselves. Okay, I have this and this and that. What is this, right? Then social media arrived. Patients, getting in touch with each other and sharing, what are the outcomes of me taking these drugs? What has my doctor told me? What is the prescription that my doctor gave me? That's how I'm living with my disease, etc. Okay. Since 2008, what hospitals and regions have been doing is to try to organize this inflow of information and data around patient portals, right? To try to make sure that this is a curated set of places, both data and information, right? With the arrival of ChatGPT, what happens is the care journeys are being disrupted, as you can imagine, right? And people, they don't go to patient portals anymore. They go to ChatGPT, Perplexity, and the others to try to find answers to this, okay? So clearly, the first stop for care won't be hospital portals. It will be patients' preferred LLMs, right? What's the challenge? Patient portals belong to hospitals, to regions, to countries. Generative AI under these models belongs to private companies and see what happens, right? So insight number 4, models will keep changing. You can be for sure about that, but they will get obsolete. If you take a 3-month holidays, when you go back, tools have changed, models have changed, okay? Workflows and methodologies will not, okay? And what we know now is that AI high performance in healthcare will use those tools to transform their businesses and redesign workflows, right? So it is not about technology, it is about what we do with technology in terms to transform our operations and the model, the business that we are in, okay? Now, to finish up, last slide, 1 minute to go. A lot of people ask me, hey, I'm interested, I work in healthcare, how can I create money and how can I create impact? What should I do, okay? So basically, if you're all in for the money, I don't recommend investing in AI models. This is going to be squeezed, and basically it's going to be trapped, and it will become a commodity at some point. I don't know when, okay? Basically, I would suggest, that's where the flashy eyes will go, but I suggest that if you want to make money, you start looking into energy and data centers. I think that's where you'll get, big bucks, okay? However, if you are, like me, more interested in impact, right? I suggest that you work in the upper side, which is in making sure that you embed AI in the right way, in a plausible way, in a safe way, with the values that we want, into the products and workflows of your companies, services, and institutions, right? And with that, I thank you for your time, and looking forward to the conversation with Pay now.